afternoon, everybody, and welcome to the session at the World Economic Forum. Our panel here today is titled When Markets Meet Public Health, Community-Led Innovation for Children. The theme of Davos this year is the spirit of dialogue, and this conversation embodies that spirit by bringing together leaders from healthcare, civil society, and social entrepreneurship to explore how citizen-centric innovation can transform the lives of children. Joining me today are four distinguished voices. We have with us Ms. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals. She'll be representing the role of private healthcare in scaling innovations. We have Olga Dyakova, co-founder of Impact Force, offering a global perspective on social entrepreneurship and collaboration. In a bit, who will be joining us is Dr. Suchen Bajaj, founder and director, Ujala Cygnus Healthcare Services. He's a doctor social entrepreneur. And we also have Mr. Mohammad Asif from Plan India, Executive Director, who brings deep experience in child rights and grassroots health programs. Thank you all so much for joining us here at the World Economic Forum 2026. Sangeeta ji, I would like to begin with you here. Since we're talking about communities, how can we really empower communities and especially children? How can they take ownership of health and hygiene practices? Apollo has done so much work on the ground. Best practices you can share with us.
So first, it's a pleasure to be here. I think Davos is about helping create a better world. And healthcare is such an important inflection point. There's technology which is transforming. There's access to new age medicine, science which is giving us new cures. And I think the health systems that will excel, survive, and become really the leaders will be those who think like a technology platform, yet act like an operating system and retain the heart in the system. And in that, I think the aspect of the social determinants of health and preventive healthcare are as important as anything that we're doing in terms of high-end care. From our organization at Apollo Hospitals, we have established one of the largest health systems in Asia. We do advanced care from heart transplants to bone marrow transplants to high-end surgery, emergency care, multi-speciality systems. But at the same time, we are dedicated to preventive and primary care. Now, I want to specifically focus on children because when we educate them when they're young about right nutrition, when we give them the appropriate enablement, when we take care of the first 1,000 days of a child's life, you are setting them up for a healthier life in the future. So these happen in partnerships with, say, Reckitt Coleman, who's helping on, they help create a hygiene path. So children play and learn the importance of hygiene.
Olga, I want to ask you from the global perspective, we've heard what is being done, in Anaconda, but I want to ask you what lessons from global child health innovations could be adopted to strengthen the entire citizen-centric development. Tell us a little bit about the work which you do.
Thank you so much. I'm really honored to be here and to share our experience from Ukraine. So when we are talking about children's health, we focus always on medicine, nutrition or sanitation. But one critical factor is often missing from strategies, chronic stress. And its core problem. Public health system cannot carry this alone. Markets shape daily behavior. Employers shape parental energy. Digital platforms shape attention. Schools shape daily rhythm. And when resilience tools are embedded into these systems, health protection scales naturally. So children now do not need perfect conditions. They need regulated adults and predictable systems. What works in the war environment, simple, measurable, human-centered solution, and for sure it should be for free and affordable for everywhere and often works everywhere. And when we integrated these simple tools in our daily routine for adults, into markets, into education and communities, child health stops being a separate sector and becomes a property of how society function. And so this is how markets and public health stop competing and start reinforcing one another. So we developed a lot of really, really simple tools like a technique of mental relaxation and how to measure it and integrate it now everywhere in our society, services and education. And we can scale it, and you can use all these digital platforms, application, engage these free tools everywhere, and you will get normal stress, resilient to stress adults, and then you can share it into
a way to manage stress. So, we have been, Dr. Bajaj, we've been talking about children, right? About how to really help them and how the communities, when it comes to children, you work very closely with children. What are the most effective ways to teach children about the importance of hygiene, obviously what leads to health, and that we can make part of their daily routine?
So I was just interesting that you asked me this. I was just discussing this at an AI session that we were speaking on earlier. And with the advent of AI, I truly feel that knowledge has been democratized to such a great extent that children now, even in grades 10 or 11, are asking us that why should we go to school? Because there's so much available on our fingertips which our teachers can never teach us. I think it'll be a much better use of time to teach these kids basic wash, activities, hygiene, how to handle disposable waste, especially solid waste, which is a big problem in a country like ours, where if you go on a road, you'll see solid waste on both the sides of the road there. So if we can actually imbibe all of these things into daily activities, teachings and learnings in our schools as well as online curricula, I think that would be much better use of the children's time rather than, learning mathematics tables, which they already have access to at the click of a button.
So just want to tell our, guests here and also panelists that this year, the Banega Swasth India campaign, which is in its 12th year, has got the Hygiene Loyalty Card to Davos World Economic Forum. It's a card that really empowers kids, children by rewarding them points. So it's like 100 action points in health and hygiene living, was something which you were saying, Ms. Reddy. It's designed to nudge behavioral change, instill responsibility, and make public health engaging and also aspiration for the next generation. We have Asif, Mohammad Asif. If you could tell us a little bit about the card, what is the USP of the card, and how do you see the Hygiene Loyalty Card empowering the children at community level?
Thank you, Ambika. So let me start by sharing that the loyalty card is one of the unique efforts that Reckitt leadership has brought in, where the whole idea is that how do we empower children? Because we have done a lot in so far as bringing knowledge, awareness, behavior change to children and their caregivers, their parents. But how do you measure it? And that was something which, and we wanted that power to be with the child herself. And this was the reason why this card was curated. This is a very simple card. It's like any other credit card or debit card that we see, which has the logo. It has all the potential that any card has it. I'm delighted to share here that the Reckitt leadership, right from Mr. Chris Litt, CEO of Reckitt, the regional leadership of Reckitt, Gaurav Jain, and Mr. Ravi Bhatnagar, all of them have had a role to play in curating, in making this card a reality. And I'm so thrilled that it's the place where ideas turn into action, because Davos has been that space, that this loyalty card, which is the first of its kind ever in the world, where power has been given to children to determine how they are making change, is being launched. And as you rightly mentioned, Ambika, this is not just a work of a few months or a few years. It's 12 years in the making. And probably the Dettol Banega Swasth India is one of the largest social development program anywhere in the world. More than 1 million schools and millions of children have directly been participating, actively engaged in bringing transformation, making their move towards a healthier and a happier life, not just for themselves, but for their peers and for their children. And with this card, I think it's going to take the whole effort to a very different level. And let me also share that at Plan India, we are very convinced that this is the card which is going to be embraced by every child. And the ambition is to take it to 40 million children in the first phase.
Amazing. And Plan India has been a very, yes, I think it's a very ambitious plan, but we've seen the work that has happened on ground. We've had partners, and Plan has been a long-standing partner. But just talking about collaborations and innovation, Apollo Hospitals, in fact, the group per se has been doing a lot of innovations. Health tech is something which we could take forward. How do you think innovations can really help children as well? How can they improvise, whether it's for their health, whether it's for behavioral change, whether it's, hygiene, for anything? How could innovation and health tech be used here?
See, I think the world that we're living right now, there are forces changing the way we live, we behave. The first one is really to have a digital access, which I'm sure the card will give. The second is to use doctors, knowledge, nurses, healthcare workers, of which we have a tremendous shortage, but to be able to augment and scale their knowledge across geographies using technology. And the third is effective collaborations and partnerships that we're talking about here, because the people who have day-to-day access to the children are not the ones who are actually in manufacturing or production. But when we come together, we can take this knowledge further. So creating platforms and enabling environments to scale knowledge, to share best practices, and to make lives better is really what I'm talking about. So imagine if we take this card and talk about health, talk about hygiene and its importance on health, appropriate nutrition, de-stress, and put these factors together. I think the end of the day, the important factor is a healthy, happy society, which is enabled either by treating disease well, so making healthcare affordable, accessible, and available. And the other dimension that we must spend enough time on is the paradigm shift on not just looking at sickness, but in health, in wellness, in prevention. So I'm very excited about the potential of this partnership to take it beyond hygiene and go into nutrition, go into mental health. And I'm happy to share that Apollo would be very happy that Total Health, where we have this large population, or Shine, which is our schools program, where we have access to about 3 million school children, or even our hospital environments, all of them, we would be happy to look at how we can scale this partnership, because the more lives we touch, the more impact we have, and the more impact we have, the healthier world we can create.
One is having a card. We've seen the work which has happened over the last 12 years. We've spoken about partnerships, but how do we ensure that children benefit? Because the card, it's not just about giving them the cards and a check mark, but how, to make sure they use it.
I think that would be the supremely important challenge for us, because that is something. But the good news is that at Plan International, because we are a child rights, we work with children and several other partners that we work with on the program. I think we are fairly convinced that we should be not just able to drive the enthusiasm and engagement of children, but also enable them to use it, working collaboratively with their teachers, with the school system, and with the community and parents to make a difference.
In fact, quickly, I know we're running short of time. Sangeeta ji also has to go. I want to ask you a question, and I will come back to you, Olga, on that from the global perspective. But when we talk about India, we're looking at Viksit Bharat 2047. Health, of course, plays a critical role. The theme here at Davos is Spirit of Dialogues 2026, the West. How do you think really India can achieve Viksit Bharat, keeping health in mind, by 2047?
I think I'm excited to try and answer this question, because it is an aspirational and a critical aspect of our whole country. I think economically, India is growing. Our growth rates at 7.2% make us among the fastest growing economies in the world. We are the largest democracy in the world, but also from a global economic perspective, at number 4, we're also slated to become the 3rd largest economy fairly soon. So number 1 and 2 are, maybe a decade or 2 away. But it's not just about the numbers. It's the quality of society that you're taking into leadership. A healthy society, physically and mentally. So I think our first goal is to embed the importance of health infrastructure, health capability, health delivery, and health outcomes into the thought process and the planning of Viksit Bharat, which is our goal for India at 100 years post-independence. So now health is moving from a social subject to potentially an economic driver, to potentially a social enabler, and also a geopolitical bridge. Because I think, thinking of health, today patients from 140 countries come to India to receive advanced healthcare with the same quality of outcomes at 1/10 of global prices. This is because of the quality of our doctors and nurses, our hospitals, and the pharmaceutical industry. We are the pharmacy to the world. Enabling and taking this thought process further, I think that we can help serve. So there is a heal in India at one level. There is a heal from India using remote care and environments to take care of the elderly or remote areas, and heal by India. That the demographic dividend of a young country can be used to help serve the world. So all these are exciting aspects which become part of the master plan of Viksit Bharat or India at 100, where we will have a healthy population and also help to serve the world to stay healthy.
Thank you so much for putting that. I think you want to.
Yeah, just to add, that on the Viksit Bharat, the point is not just about reaching that goal, Sangeeta ji, and you have beautifully put, especially from the health lens, that it's not just about the palliative or cure, but also looking at health in the preventive and the pre-preventive stages as well. But I think the important question which I would like to also bring here is that it's not just about reaching that goal of Viksit Bharat. It's also about retaining that position and continuing with that. And that's where today's children, who will be 21 when India achieves that stage, they have to be nurtured and supported. So again, circling back to the question of that. So it's about, we'll have two challenges to play with. One is to reach that goal, and the second is to retain ourselves on that goal and continue to keep the ball moving. And that's where investment in children,
population into that.
And investing in children is therefore the smartest thing to do.
There's a direct connect with the economy as well, right? Dr. Bajaj, as a global social entrepreneurship awardee, you've obviously worked on ground. You're also working in the States where our campaign, Banega Swasth India, has been working. We were talking about the Hygiene Loyalty Card, which, we brought to Davos this year. How do you see, the intersection of access and innovation when we talk about that? Health tech transforming last mile healthcare connectivity. We were talking about the ASHA workers, how they help make sure that access is given to each and every one. I mean, ensuring that our health reaches all. Your take on that, especially on health tech, I feel.
So till very recently, I also used to sit on the board of FIT at IIT Delhi, which is the Foundation for Innovation and Technology Transfer. And there we mentor a lot of health tech companies. I am personally an investor in a lot of health tech companies. The most recent one that I saw, which I felt very proud of, even though I don't think it's a very investable concept, is a company called kudadekho.com or watchyourgarbage.com.
So kudadekho.com, which means watch your garbage. Yeah.
And in that you can very easily watch out for any garbage anywhere. Just click on it. It gets a geotagged photograph and puts it up on the municipal corporation helpline as well as online on social media to, just maybe name and shame the localities that are doing that. I'm an investor also in a lot of other companies like a diabetes monitoring platform where you can monitor your diabetes on a daily basis, in fact on a minute-to-minute basis, and see what is impacting your blood sugars, whether exercise really affects it or whether some particular food items are affecting it, so that you can, manage your blood sugar levels to a greater extent. So a lot of health tech companies coming up which are managing day-to-day problems and giving a lot of insight into our daily routines as well.
I'd like to thank all of you for joining us today. Thank you all for listening so patiently. It's really been a pleasure to be here at the World Economic Forum 2026 at TPC House. Thank you so much.